Good afternoon and welcome to a virtual town hall, breast cancer care in the time of COVID-19. I'm Sarah Loudon from Total Health Conferencing, and right away I apologize for being a couple of minutes late. My internet, as expected during COVID and in the year 2020 and right at the time we were to do a live event, went down, and so I apologize, but we will make sure that we catch up on time. So if you've joined us for previous town halls, you know the format and you know how incredible having these interactions with these various stakeholders in cancer care are. If it's your first time with us, I'm just going to take a minute or two to describe to you the format so that you get ready for what's coming up for this Saturday afternoon. We always start with an interview with advocacy leaders. Today, I'm joined by leaders from Gilda's Club and the Florida Breast Cancer Foundation. We then will move into interviews with medical experts, and we have some really phenomenal people on today from Cancer Treatment Centers of America in Philadelphia, from Columbia University in New York, and from Emory University in Atlanta. And then we're going to be joined by a really great conversation with a clinical nurse educator from Puma Biotechnology, which I feel will be a special part of this presentation because of the perspective he will come to our audience with. And I know that I have a lot of questions. I'm looking forward to seeing the questions that the audience has for him. And then we'll round out the presentations with a patient testimonial. And then all of us will get together for a Q&A. This is both a webinar and being broadcasted on social media channels. I encourage you, as you're listening, to start asking questions, start engaging with the panelists through the chat function, both on the webinar system as well as Facebook and other social media channels. We'll be getting to those questions both through those channels as well as in the live Q&A section at the end. So having said that and giving you the format, I'm going to ask all the colleagues who will join me later for segments to mute their screens and start with interviewing Tracy and Kim from two really incredible advocacy organizations. So ladies, thank you both for being with me this afternoon.
Thank you for having me. I'm so happy to be here.
It's really, you know, I'll tell you, we've done these town halls now since the beginning of COVID, and we've had thousands of people engage with us. And the testimonials that I've gotten, even from people just sending me a quick Facebook private message or an email, is that it really reached them at a time where they were looking for some positive, uplifting, credible information, and they felt like this was such a great way to spend time getting to know people and getting to know what we're all doing with our passions and our purpose. So having said that, I want to just start with asking each one of you to introduce yourselves and then introduce your organization with as much detail as you feel necessary in order to set the stage for what we're going to talk about. Tracy, I'd like to ask you to go first.
Okay, great. Thank you so much. So Tracy Jason, I'm the president and the CEO of the Florida Breast Cancer Foundation, FBCF. I have to say that acronym because part of what we do is constant awareness as we grow throughout the state, and we want you to know what FBCF is. So I know, Raina, you want us to keep it relatively short, so I'm going to do my best and bullet point my organization. So we began back in 1993, the Florida Breast Cancer Foundation in Miami. We currently have an office in Miami and in Central Florida, but we have statewide programs and statewide reach. Our mission is to end the suffering caused by breast cancer through education, through research, through direct services, and through advocacy. I'll begin with research. We fund research grants yearly, and I'm happy to say that during COVID, we were able to fully fund. And we fund education grants. We have researchers on our board of directors who literally spend their days in the lab, one of whom working to find a way to stop the metastasis of cancer cells. Imagine that. That would have implications for breast cancer and all cancers. As far as education goes, clearly knowledge is power. And we believe in that, and we live by that daily. We do our best to educate so that folks can adopt healthy lifestyles and possibly sidestep this disease. We also educate in a big way about early detection, because as we all know, early detection is key. It's the late stage diagnosis that leads to often death, and that's what we want to avoid. So we're really focusing on all age groups, but a big focus on the younger crowd. We want to reach people young, and we're focusing more and more in the high schools and in the colleges, so that breast cancer really, with the modern technology and all that we know, it certainly is not a death diagnosis. I think we all know that now, but those who don't need to know it. They need to know what to do, and they need the resources to get the treatment that they need and that they deserve, which brings us to advocacy. We have folks that go up to Tallahassee and fight hard to not only affect policy that will give patients the ability to get the treatment they need and the treatment that they deserve, but also to affect policy that will allow physicians to treat patients in the best way that they need. And we try to affect policy that will hold big business accountable so that patients and healthcare decisions are guided not by dollars, but by patient need and patient care. We also advocate in the communities through the education process, advocating for each and every one of you, really, so that you have the knowledge and the ability to reach the knowledge and the resources that you need. Lastly, we have direct services. So this was a pilot program we began last year, and it was very successful. And I'm really excited about this in particular because it's a direct reach to folks, a direct dollar to folks who need it. It's about providing that money for living expenses and or mammograms. And we've even expanded it during COVID. And I think you're going to have another question at some point where I can elaborate on that. And then lastly, just so everyone is aware, because sometimes I find that people are not aware of this, we are the End Breast Cancer license plate in the state of Florida. We have a long-standing partnership with the state of Florida. If you purchase that End Breast Cancer license plate, not only are you helping us through the awareness, and our website is on there, but the plate itself costs $30, $25 of which comes to our organization. And all funds for our organization, we're a statewide organization and the only breast cancer organization in the country to receive a 100% perfect score from Charity Navigator for our use of funds and operational model. So if you buy that plate, you can be assured that that $25 is going to your friends, your family, your neighbors, and people who need it. We don't spend the money on overhead. We spend the money on programs and doing our outreach. And that's why we got that 100%. And the last thing you need to know right now is that we are partners with Pickups for Breast Cancer. If you haven't heard of them, go to our website at floridabreastcancer.org. Essentially, if you are, which most of us have been, right, during coronavirus, you're at home and maybe you're cleaning out your closets, which I confess I finally got to, a little late in the game. But if you have stuff you want to donate, an easy way that you can help us is just go ahead, go to our website, look up that number. Folks will come and pick them up, and we get a portion of those proceeds to continue all of the above programs. So we're here to help you.
Thank you, Tracy. I mean, I live in South Florida, so much of what you have described, I'm aware of because you do such a great job of letting the community know who you are, what you stand for, and how they can get involved. But I'm really excited to kind of get the audience to know a little more how statewide organizations really can support patients with breast cancer, living with and beyond breast cancer.
Exactly.
So,
thank you for telling me that, by the way. It makes me happy to hear that because it's important. You can do all great things, but people need to be aware of it.
That's right. Absolutely. Absolutely. Kim, if you could introduce yourself, your role, and tell us a little about Gilda's Club.
Thank you so much, Sarah. Good afternoon to everyone who's listening. My name is Kim Prytano. I'm the CEO of Gilda's Club, South Florida. And we're located in Fort Lauderdale. However, we serve all of South Florida, and we're part of a national organization called the Cancer Support Community. So we have affiliates throughout the country. Many of you may have heard of Gilda Radner. She was one of the original cast members of Saturday Night Live. And in her heyday, she was one of the funniest comedians on the show. Unexpectedly, she was not hired as the main star. And shortly after she reached stardom, she was diagnosed with ovarian cancer. She probably would have lived a long, full life. However, she was misdiagnosed for about 8 months, and she died very young. And she knew she was going to die. And her wish was to her therapist and her then husband, Gene Wilder, also an actor. And she wanted them to promise that they would start an organization to build community where people could go and not have to face cancer alone. And they did that. And our organization, 25 years later, we are providing direct services, and we talk a lot about the social determinants of health. And the focus of Gilda's Club really is to address the social determinants of health in any type of cancer, and including breast cancer. The clinical piece is one piece of it, but there are also all these other components that Gilda's Club addresses. And those components are to educate people, not only on treatment options, but on their disease, to teach them and their family members who are so hungry for information. We provide support groups. We provide healthy living classes. We provide opportunities for fun and social interaction, especially in Florida, where many people are isolated, living alone, moved here from somewhere else, retiring here. We also, over the years, have grown and expanded. We provide health education in middle schools and high schools to, this past year, 3,600 students. If you think about it, kids are making decisions and choices to smoke, to vape, to drink, to use drugs, and even more simpler, to go out in the sun without using sunscreen. Those are all things that we want to address now, because those are decisions that they're making right now that can affect the rest of their lives. So that has become such an important component of what we do. Health equity is one of our largest programs now. For years, we've been working in the community to encourage early screening, early detection, early intervention in breast cancer among African American and Latino women, and all women of color. It's an area that we really need to address if we want to impact the mortality rate. Most white women will survive breast cancer and live. That's not so in women of color, and we want to change that, and we want to make a big difference in that area. We also provide services. Our national office has a research and training institute. So all of the research that we get it from our national office, and getting that information out in the community is important for us. And it's done specifically with patients. We have about 15,000 patients that are registered in our research bank. And we ask them about their cancer experience. What is it like? What are the issues that are important to you? What are your needs? Because we have to ask patients about their needs in order to provide the services that are important and meaningful to them. And then lastly, our Policy Institute, those folks are right in Washington, D.C. And so they're the ones that are talking to the legislators and really bringing those issues to the forefront throughout the country and to our local affiliates. So I have people that I can go to for help and say, you know, in Florida, we're struggling with telehealth. We're struggling with getting support services and direct services to people with cancer. And right now in Florida, one of the biggest issues that we're advocating for is through COVID, and I can talk more about it later, but people are not going for their breast health screenings right now for various different reasons. And so the number of diagnoses of cancer has gone down. In this context, it's not a good thing.
Yeah, agreed. And we will get into that. And I think it's another reason why it's so important to have these advocacy conversations, because, doctors are focused on cure, and, in a lot of ways care. And advocacy, definitely focuses on cure and care, but we also focus on so much education so that up to that, and then beyond that, we really provide those individuals with what they need, the tools they need to kind of get through from beginning to end. So we definitely will get into the effects of delayed or missed altogether screening. Tracy, I'm going to go to you and ask you, back in the beginning of March when all of the world turned upside down, how did the Florida Breast Cancer Foundation, what kind of things did you do immediately that allowed you to stay strong through this and to kind of remain a resource for the people who depend so much on you?
Well, I can remember the exact day, on March 13th for us, when I decided that we would go into telecommute mode like the rest of the world. We moved fast, I think, because first and most important, maybe because I have a child, I'm sort of joking. I think we all subscribe to the idea that really it's kind of, do what I do, not what I say. And I wanted us, first of all, to live by example, and the people that we serve were at the highest risk, or some of the highest risk. And so immediately went to telecommuting and thought to ourselves, okay, we got to show folks that we can be safe and that we can handle this situation while still moving forward, not go home and become absent. Go home and find a different way to do things. So first thing we did was, okay, we went home. Everyone got the tools they needed. Second conversation with staff was, we got to go virtual. So for those of you who aren't used to getting on Zooms, got to learn. So we just worked on some training in that regard. And then we started to look at our programs. And like we talked about prior to this, we had a conversation, for those of you at home, prior to actually going live here amongst us. And the conversation was how, the whole etiquette of Zoom has changed. I remember my first Zoom, as the story you told was very similar. My 6-year-old popped on at the end. Kim, you were on that one, actually. We partnered with Kim and Gilda's club, and we had 2 other oncologists, one from Miami, one from up here, to educate our constituency, so to speak. And Georgiana made an appearance. Well, rewind a year ago, that would have been just awful. And now everyone accepts it because we're all used to this peek into our world. So we continue to do virtuals. We do Facebook Lives because really the way we view it, and I don't think it's an opinion, I think it's a fact, the need for what we do is even greater now during coronavirus. First of all, because our breast cancer folks are at higher risk, A, and secondly, because they're facing even bigger issues. Folks who were currently underserved, underinsured, now the little insurance they had might be gone because they lost their job or they're not working, or they were relying on their spouse and that person lost their job. So one of the things we did, I spoke earlier about our granting and our direct services. I'm really proud to share with you that we also took $50,000 and started an emergency COVID-19 emergency assistance fund. And we made the threshold very low on purpose. We want it to be easy at a time when everything is hard. The only qualification is that you are in treatment, breast cancer treatment, and that you've been impacted in some way by COVID. We are funding this money out to nonprofits who provide the living expenses. And what we're hoping to do with that is grow it and continue it. But it's a start, and I'm proud that we're able to do it in addition to fully funding all of our other grants. The other thing that we're doing virtually is we have a signature education program called MASS. It's mammograms after Sunday service. But it doesn't always involve a Sunday service. It's a program that was started by a breast cancer survivor herself, and then we've enveloped her into the organization. It's an award-winning program where it began as her going to primarily, but not only, but primarily African-American churches and those communities, because they're at great need, as Kim alluded to earlier. I mean, those are the folks that often aren't getting the education and the resources that they need and not having the same results. So you go to a church and she would educate folks. By the way, I've attended some. She's a piece of magic. You know, she's walked the walk. And so she's just amazing and inspiring. So how do we keep doing mass now in COVID? Well, we will begin mass virtual in a few weeks, and I'm so excited about it. So she's partnering with various pastors to reach these folks. It's interesting because when she first reached out to them, there was some hesitancy, because I'm sure you discovered the same thing. Depending on what your background was, my background prior to life with Florida breast cancer was sitting on a board of a breast cancer organization in TV news. So for me, this is my wheelhouse. But a lot of people with great strengths, this part's not their wheelhouse. So how do we get these strengths out here? And so when she was talking to the pastors, they were not that excited at first. And so not only are we educating people and doing outreach to our constituency, but we're helping these pastors now, educating them on this new way of doing things. And I'm so excited about that, because I believe at the end of the day, we're all in it with the same goal, right? And I love this kind of give and take and this yin and yang, and all of us helping and working together during this time to be effective. So Mass Virtual will roll out in September. Mass, by the way, we're also heavily partnered with the State Department of Health, which is a incredibly important partnership for us to do what we do, because when we do provide mammograms and mobile mammograms, it's through the state and their BSEP program, because we don't want to provide that and not have the continuum of care. So we're an all-encompassing, the whole package program, and I'm excited about that, actually. So anyone listening, if you think you know of a church or a group, or you have some of your friends and you would like this type of education, please reach out to us. Again, go to floridabreastcancer.org. We can facilitate, and we want to facilitate this and make this happen. Like we all talked about earlier, we could do a lot more now because we're not driving. So anyway,
the world's gotten a lot smaller in so many ways, and I think people have gotten so much more connected. And even people, I mean, my mom is 73 this year, 74. The other day I was on Facebook scrolling down, and it's like, oh, you have a friend request, and it's like my mom. My mom doesn't know how to use a computer. My mom was like, whatever. But she's got a small group of ladies, and they were all like, let's get on Facebook so we can stay connected to our kids, our grandkids, our church, other things. And so we're all, as a society, I think one thing you can say about Americans, there's a lot of things you can say about us, but one thing that's kind that you can say about us is that we really are resilient and we evolve well. When something happens, there's always an opportunity to say, okay, how do I normalize something new so that I can still get that benefit? So Tracy, I really love that you're going, this follows perfectly with why I think advocacy organizations that do well. It's because you go to where the need is. You don't sit back and expect everybody through marketing and et cetera to come to you. You say, okay, this situation matters this much that we've got to find a way to get it to you. So I love so much of what you described were pivot points for you and Florida Breast Cancer Foundation. Kim, same question, but a little bit different, because for me, all of my experience, I've been in cancer care now for probably 17-ish years. And all of my experience with Gilda's Club, the power has always been most evident in the way people gather. That, you go into a support group and it takes all of 90 seconds to feel like you've been there all along. And your activities are so inclusive and inviting, intimate and wonderful. What did you do to kind of carry that through and make it so that in virtual environments you could have the same effect?
So it's so interesting that you say that, because at the beginning of March, we were watching, many of us are from New York and New Jersey, so we were watching, you know, home and what was going on there. And we said, we got to get out of here. But we call the patients who come to Gilda's Club and their family members, because they're members of a community, as you said. And we realized if we don't close the doors, they're going to keep coming here, and it's not safe. And so, you know, the first week of March, we had this conversation, and by the second week, around the same time as Tracy, we said, we have to go home, and we shut the doors. And we knew that what you said was true. And we said, how are we going to recreate this environment? And so we built the Zoom photos, and the background screening is the same as the support group rooms that the people were in, so that when they came into the Zoom room, they would see that room. Oh yes, my support group is in the library, and mine is in the Florida room, and mine is in the yoga room. So they would see those rooms. All of our fitness classes, the teacher, most of the fitness classes, the instructors come to Gilda's Club, and they use the actual fitness room to video the, and they're streaming it live. So they're actually live doing the class. So people are participating, and it's kind of like they're at Gilda's Club.
Yeah.
But I will say that, you know, when people go to the doctor and they get really bad news, and they need a hand to hold, and they need somebody to hug them. The support group is there, but it's not the same. There's nothing that will replace the human touch, and they long for that. And they, you know, we will probably always have a hybrid going forward, because instead of only being able to provide 15 or 20 programs a week, we can provide 40 now.
Wow.
Because we don't have the constraints of space and rooms, and you know, we can only do this many of support groups at one time because we don't have enough parking, and we don't have enough space for people to sit. We don't have that problem anymore.
Yeah, there's definitely a balance. Like, there's been trade-offs in all the different things that we do, but you know, it's really beautiful to just envision that when you're so used to coming to that safe space, that you still feel like, how you said, you could go into the Florida room and just know, like, okay, this feels comfortable, it feels safe, it's familiar. And I think I feel like those little touches are what makes Gilda's Club so powerful to start with, that you're always thinking about ways to enhance the connection. And so it's really beautiful that that was one of the solutions that you brought to the table since COVID. And I definitely agree with you. I think Tracy would too. Nothing replaces the personal touch, you know, whether, and I've had the honor of interviewing dozens and dozens and dozens of advocacy organizations, and everything from, you know, Light the Night from Leukemia Lymphoma Society, or the Race for the Cure with Komen, where you cross finish lines with people, where you're able to kind of see who the person's running for, like you can embrace all of those wonderful things. We're missing that. But I think as a community, and especially as a community of advocates, we realize we're doing it for the greater good of those that will come after. And for our population, which, as you said, Kim, I mean, these are the people who are the most susceptible to COVID-19 and its effects. So we've got to always think of them, keep them in mind in terms of how we're building things out. But I so appreciate how both of you have innovated during this time. You know, both of you mentioned health equity and equality. And this is a national conversation. I think it affects different regions differently. Since we are broadcasting from South Florida, and both of you are part of Florida advocacy organizations, Florida is such a melting pot. I mean, you have all different groups of people living around and close to each other in their own communities. And do you feel, like the mask program, and like some of the initiatives that Gilda's Club has been involved with reaching women of color, do you feel that you have to be one step more innovative in reaching out to at-risk communities who may not have the same resources to participate in a lot of the virtual things that we're doing? And if so, Tracy, I'll start with you. How do you bridge those gaps so that the at-risk isn't even more at risk because they don't have even basic access?
Well, that's interesting. So mass virtual rolling out in September, and we thought about that because obviously you can see with the schools and the underserved communities, one of the big issues was that children there don't have a nice computer to sit at, don't have Wi-Fi. So you can again provide this service, but if people can't get on, it's pointless. So what we're looking at doing right now is a couple of things. One, the pastors will be assisting with that. And hoping and helping their constituency to have the right resources. But what we're working on right now is actually an app on the phone because, standardly, if you look at demographically, usually folks in underserved communities do have a cell phone, though they won't have a laptop or the computer, the desktop. So we're looking at doing an app now, which again, is kind of one of those things that we wanted to look at anyway for mass, but if it wasn't for COVID, maybe with everything else going on, we would have put it off a little bit. But frankly, now's the time. So not only is it a way to bridge that gap, but I think it's an opportunity for the organization to get to a point that we needed to get to anyway. I think you probably agree there's a lot of those moments in this moment, there's a lot of those moments, those silver linings.
Yeah. It's definitely, as I mentioned in our kind of pre-call, as everyone was getting ready, we as an educational company, we felt like, okay, we provide education to oncologists and they kind of take that and translate it into clinical practice. And when COVID upended everything we ever thought we had on lock, we realized we were missing such a special opportunity to include the voice of the patient and to partner with the voices of advocacy groups who tirelessly pursue the answers on behalf of that, end user, the patient population. And it's been, talk about silver lining. I feel like I never want to go back, even when we are able to hopefully go back to live meetings. I never want to do a meeting that's absent of the patient and advocacy voice because it's the most powerful voice in the room. So I just feel like I can identify 100% with you that these are things we should have been doing, but corporate priorities get in front of it, and then something like this happens and you say, yeah, that's an important thing. So exactly. I agree too. And I'm really proud to see how Florida Breast Cancer Foundation is solving these issues for your patients. I think that's fantastic.
Yes. There's one more thing to that point too that I think is worth mentioning. It just came to mind. We also work closely with Moffitt Cancer Center, and we've partnered with them. They have a community advisory panel that they invited me to be on to represent the organization, which is a panel where they get folks within the breast cancer community, and it's focused purely on making sure that those minority populations and those underserved populations are not only represented in resources and care, but they're represented at the clinical trial level. Yes. Because that's an issue as well, that you have these trials and those populations are not a part of, so the results don't necessarily fit. So anyway, I'm very excited about being a part of that too, and they're doing some great work. And to your point about partnerships, when you work together like this, which is why I'm so happy that you included us, really we can all help each other. So doing that partnership, they're going to help us in that way reach those communities too. You really can't do it alone. And it's funny, the last thing I'll say about this, because I know you want to get to Kim, but it's such an important piece for me. And I tell my staff this all the time, and our volunteers and our base, that at the end of the day, we are the Florida Breast Cancer Foundation, and we're proud to be. But every single person on this call, we're all in it to the same end goal. And really the power is in numbers, and the power is going to come when joining forces and working together.
Yeah.
And we're big proponents of that.
Yeah, absolutely. That amplified voice. So a friend of mine, he's a Spanish from Mexico doctor, and he always gives these quotes, but it always gets lost in translation. Every time. I'm always like, I don't know that plays from Spanish to English.
Yeah.
But the other day he was talking to me and he said, there's something in Spanish, and he says it in Spanish. And then he says, it translates that we're not all brave, but there's a lot of us. And it was such a moving thing, because I said, like, Franklin, that's the first thing you said that made sense in the translation. But it also kind of made sense in my heart, because you have everybody from small organizations to individuals to people that are focused on maybe research or maybe education or whatever, some segment. And we might not all have everything we need to come up, but when we're together, we have everything we need. So I agree with you so much, Tracy, and hopefully in the Q&A, we can kind of expand a little bit on that. Kim, same question to you in terms of, thinking about the way patients, especially in South Florida, but probably all over, travel to support groups, especially older patients, and especially those who might live alone, widows, people that are transplants here that don't have a big family structure. How has Gilda's Club, before you could get on a bus and get to the place, how has Gilda's Club looked for opportunities not to forget those who don't have that big social structure that helps them get connected?
A couple of different things. We started the conversation talking about equity, and equity doesn't mean that we are going to address everyone in the same way. It means that we will address everyone and give them the tools and resources that they need to get the same opportunity. And so when we look at seniors and we look at communities of color, we're looking at, we do Gilda's on the go. If we were in person, we are doing our Gilda's Club services in different locations. And one of the things that we are looking at now is, should we be working with the housing authorities and doing our support groups there? We already work with churches a lot. We work with domestic violence shelters and homeless shelters. And we provide, yesterday we just did a program at a domestic violence shelter. So the gathering of the people is already done for us. And so in times of COVID, we don't have to worry in the same way about that fear of bringing people together. So there are ways that people are already together that we can get that information across.
Yeah.
We will never give up the virtual platform. What we will do at Gilda's Club is improve the platform.
Yeah. Well, I appreciate both of you. I told you that, our time goes so fast. I always, at the end of series, so in the summer, when we did the summer town hall series, we did each one of these, and then I bring all of you back for a podcast, an evening podcast where I just bring advocacy back, because while the doctors have phenomenal things to say, the companies supporting have phenomenal things to say, obviously the individual patient really brings us a perspective that we need. Getting together with all of you all and hearing what's going on, and then connecting different dots where you can say, oh, that would be great for us too. It goes back to, in numbers, that amplified voice, we really are stronger than when we are alone. So I'm going to ask you both to sit tight. We'll get back to the larger group Q&A at the end. I'm going to ask my team to bring up the medical leaders. And for those of you who are listening and watching on Facebook, all the resources, or as many of the resources as we mentioned, will be attached to the recording of this and given out so that you can dial into the resources that the various people provide. And also bios on each one of our medical experts will be given so that you have an opportunity to reach out to each of them as appropriate. So I want to introduce our interview with medical leaders segment. I want to thank our 3 doctors for joining us. As I mentioned, they come from 3 really incredible organizations all over the East Coast of the United States. And I can't wait to dive in with the various things. So I'm gonna, in the interest of gender equality, Kevin, I'm starting with you since you're outnumbered. If you would introduce yourself, tell us where you're from, and a little bit about your practice.
Sure. So I'm Kevin Klinsky. I'm a breast oncologist at Columbia in New York City. I've been here for over a decade. Starting in November, though, I'll be joining Jane down in Georgia at Emory to go back to our Southern roots and to join the great group down there. So I look forward to chatting about this. As everyone knows, New York City was the epicenter of COVID. So I think we learned a lot of lessons the hard way. And I look forward to talking about some of those.
Thank you. Thank you. And Jane, I'm jealous that Kevin will be with you all.
I know, we are so.
I wish he came further south to Florida, but maybe he'll make his way down as his hair grays. Everybody makes their way down.
I'm gonna hang on to him. You can vacation down there.
It's a natural migration from New York to Florida.
I know, right?
In that interest, Jane, I'll ask you to introduce yourself, where you're from, and what your practice is like.
Sure, perfect. So I'm Jane Meisel, as Sarah mentioned. I'm a breast oncologist here at Emory, and I've been here about 5 years. I actually did my fellowship in New York City, but grew up in Atlanta, so had always kind of wanted to migrate back here after I finished my training, just to be closer to family and kind of optimize work-life balance. And Emory's been a great place for me. So I have an academic practice. I see patients in clinic 2 days a week, 2 very full days. And then the rest of my time is spent doing research and teaching. And I would say, yeah, there's so much to talk about in terms of COVID-19 and how this has impacted really everything we do. I mean, the research, the teaching, and the education of our residents and fellows, and then most importantly, the way we take care of our cancer patients, and the options we have to help them manage through all of this.
Yes.
So looking forward to talking with everyone today.
Thank you. Thank you. And Sharmila, you're on mute, but I'll ask you to introduce yourself.
Oh, sorry about that. Well, Sarah, thank you for having me in this town hall today. I know that this is such a powerful platform from collectively sharing all of our thoughts during this time. I am Sramila Aithal. I'm a breast oncologist working at Cancer Treatment Centers of America in Philadelphia. I have been with the organization for the past 13 years, and I love every single moment. It gives me the opportunity to care for my patients. Thank you for having me, Sarah, again.
Thank you. And I want to always say this because a couple of years ago at our, for our listening audiences ears, a couple of years ago at our large cancer meeting that everybody used to gather to, about 50,000 of us used to gather to in Chicago, there was a presentation done by a young Latina oncologist that really talked about introductions and affiliations of doctors, and how, you know, doctors go through a lot to earn their titles, to earn being kind of recognized equally. And it was, her study was on how many male doctors are always addressed Dr. X, and then female doctors are addressed in this case by Jane or Sharla. And it was a bias that was noticed and noted in a big research study that was done. And I want to say that because in the interest of this town hall, we are coming to you as all friends. And so when I call Kevin, Jane, and Sharla by their first names, it's very much more so that we all kind of are coming together as friends more than anything. But it is something I always like to point out because, you know, we, especially in times like this, when we think about our life and the things we've accomplished and the things we're proud of, it's important to make sure that equally everyone's given their dues when it comes to even something as simple as introductions. So Kevin, I'm going to start with you because, you know, you mentioned in the intro, New York being the epicenter. So let's go back, that was many, many months ago to March, where everybody was glued to their TV, and we had, you know, everything from how many people were being diagnosed with the virus, how many people were dying, where it was happening. It was kind of newly here from another scary European experience and another scary Chinese experience. And so here we are looking at New York, and the rest of the country is thinking the same thing is going to happen in a matter of time to our communities. And so gratefully and thankfully, through the efforts of people like you all and our public health system, et cetera, we all masked up, we all stopped the things we were doing. We all started to quarantine, and I think due to those efforts, we didn't have the New York experience. But share with us, what was it like to provide cancer care at a time where things seemed terrifying?
Yeah, I mean, that's actually the word that I would use to describe it. I think it was really scary. I think it was confusing and scary for everybody. I think it was for the patients. I think it was on the provider side. You know, I was on service during the peak, so you got to see, unfortunately, very sick young people. And, you know, I think that we quickly adopted telemedicine. And, you know, as Kim and Tracy kind of alluded to, you know, I think that moving forward, when we hopefully live in a land which is a bit more COVID quiescent, I still think that there will be a role for telemedicine. But I think that from what I was hearing from the patient perspective was just this fear of coming into the hospital and being exposed and things like that. And, you know, what ended up happening, you know, also keeping in mind that at my institution at Columbia, we weren't operating on patients, right? Those operating rooms were being turned into intensive care units. So we were juggling everything and giving patients who might have otherwise been going to surgery, hormonal therapy, if their tumors were hormone receptor positive, or coming up with some sort of approach because our surgeons weren't able to operate on those patients. But what I will say now, and I was thinking about this week, on the flip side of that, you know, at my institution currently, you know, things are feeling as close to back to normal as, you know, they were before COVID. I mean, everybody's masked and we have all of these safeguards in place, et cetera. But we are busy. We're doing screening mammography again. I mean, it's one of the things that Kim and Tracy had mentioned. It was one of the things that we were really concerned about, patients who weren't going to be getting their mammograms, because essentially from March to May, we weren't doing any mammography. So we did have some patients who had unattended breast tumors. I've had some patients I've been following for some time who had some delays in getting their mammography, and we identified new primaries. But now that we're doing mammography and screening, it does feel like we are getting closer to normal with all the caveats of safety that I mentioned.
Mm-hmm, mm-hmm. Jane, you know, it's a little bit, thinking about Kevin's experience being kind of terrifying in terms of being in the middle of it. As a cancer care community, it's a little terrifying that screening is going so delayed. and that there are still people that are like, is it worth it? Like, should I go? What's it going to be like? Especially since the average everyday mom, like me, I don't go out a lot. So when I think about a hospital or an outpatient center, I'm like, that's the last place I want to go. Can you reassure the listeners that we are at a place where the risk versus benefit of delay way goes in the favor of get out and get screened?
Yeah, no, I definitely agree with that. And I think it's interesting because for us now, our COVID peak obviously has come a little bit later than New York as in Georgia. But our shutdown kind of took place before we really had a whole lot of COVID. So I think when the New York experience was happening, the whole country was kind of panicking. And in late March, early April here, similarly, mammography was shut down. They reopened at I think kind of mid-May. But I think, what's happened is everyone then thought this was just going to be like a quick thing. Schools were going to shut down for 2 weeks and then we were going to go back to normal. I remember an email that my son's teacher sent him like the night school closed, being like, this has never happened before, and we're all going to have to work together for these next 2 weeks. And I look back on that email and I'm like, oh, things really have been so much more wide reaching than we thought. But I think what we've learned from that as a medical community is we can't just shut down. We have to figure out a way to carry on and keep cancer care going, including screening, in the face of this pandemic, because it's not, it's going to be a matter of months, and it may even be a year before things get back to some semblance of normal. Yeah. So I think, even here in Georgia, where numbers are actually embarrassingly high now, I think as a mom, as a doctor, one of the places I actually feel safest is at Winship, at our cancer center. Because everyone who comes into the building is being screened for symptoms. They're having their temperatures checked. I get my temperature checked every day. Everyone's wearing a mask. You aren't allowed in without a mask. The sanitization procedures are top notch. I don't know of a single person who has gotten infected being in our building. I think the much scarier places are the restaurants, being in the grocery store, all these places where we don't have rules. Yeah. And I come to work every day. Thank God I've been healthy, but, I've seen a lot of people, but, you're socially distanced. So I think coming in and doing your screening absolutely outweighs not doing it. And I definitely have seen patients in the past few months, even the past few weeks, who were diagnosed with a cancer in March, and then we're told, March 20th, we don't know what to do. Like, you should probably do nothing. Goodbye. And then they show up at my clinic 4 months later with disease that's more widespread than it needed to be. So I think, that key is figuring out how to proceed with cancer care and not compromise it if you don't have to, because this is going to be something that it's not going to go away. So we just have to figure out how to kind of take into account the risks and benefits and help patients navigate as best as they can.
Yeah, and my takeaway as a layperson from what you just said is we are, as communities, taking the everyday risks of, Uber Eats, pizza to the house, go out to the grocery store, pack up on the essentials, maybe a Target run for something small. So when you think about, the feeling of being scared about going to the hospital versus those everyday things that we're doing, we don't have the standardized screening and protection in those other settings that we do have in the hospital because we have to have it in a hospital. I think that the audience should think about it that way and say, well, wait a second, I am taking measured risks. This needs to become kind of top priority on a risk that I'm willing to take. So I do appreciate too the contrast that you just drew to, going out to a restaurant. I think people are making their lists of what they feel comfortable doing. And so the encouragement to everyone listening, and hopefully everyone will share from what they learned today, even if it's one sentence on their social media platform to say, when was your last mammogram? When was your last pap smear, colonoscopy? Things that really change the way a disease is diagnosed and managed the earlier we catch it. So I appreciate you sharing that. Sramila, we are, thinking about big cities versus small cities all over the United States. And, Philly is a place where you think is also a melting pot. It's also, you think about New York and Philly in the same kind of top 5 places that you have so many people gathering together. What has been the experience in Philadelphia, and how have you and the organization, not just CPCA, but what you've seen your colleagues do at Fox Chase, Jefferson, Penn, what has been the experience in terms of getting back to good cancer care?
questions, as you know, that now a few months.
Oh,
Right.
just give me one moment. I'm having a little technical issue with your sound. Was that just me or?
No,
Are you able to hear me?
No. If you wouldn't mind, just drop off and sign back on, and then that way we should be able to kind of get your audio good. While Sharla is doing that, Kevin, I'll take the next question to you. I know that I'm not alone when I share that anxiety, fear and anxiety have become part of everyday life. You know, I get the pleasure to see Jane's little boys on Facebook, and I too have a little 6-year-old, and they, you know, the kids seem in a lot of ways oblivious to, you know, they definitely know what's going on and that they have to wear a mask and they have to fist bump or elbow bump. But it's different. As a mom, I'm scared. As a wife, when I think about, you know, my husband leaving the house, going to work, or you can go to Home Depot, I'm scared. I'm like giving him a, you know, make sure you sanitize this, I'm scared. I feel like I'm scared of everything so much. And I am a patient, but of an autoimmune disease. How do you, or do you find yourself spending a deal of time talking patients through fear and anxiety at this point? And what do you think your overarching message is to listeners about how to manage that?
Yeah. So, I mean, I think that right now, all of our lives feel disrupted, right? And then with the addition, as you were saying, of Jane and yourself and having young kids, you know, it's like this additional juggling that that you're doing. I think that when I talk with patients, because everyone's still anxious and fearful for the most part, and I think that, you know, sometimes and one of the things that I wanted to convey on this was just some of the data in terms of what we're seeing in patients who have cancer or a history of cancer and are diagnosed with COVID. So we published on some of our experience at Columbia in patients with breast cancer. And, you know, for the most part, patients really did well, right? And these were patients diagnosed with COVID. And there's small series that have also been reported out of Europe, including French series. And then there was a larger study that really, that included Canadian and US centers and really showed that it was the patients, and these are all patients who had a history of cancer. It was really the patients who had other health issues like smoking and other comorbidities like uncontrolled high blood pressure and diabetes and things like this, multiple comorbidities. Males, you know, these are populations who seem to, if they were diagnosed with COVID, tended to do worse if they had a history of cancer. So I think it's about also just explaining that, you know, the hormonal therapy that you're taking, that's not necessarily putting you at higher risk than somebody else in the population, right? Unless you have other comorbidities that would put you at risk. So I think it's about, you know, it becomes very patient specific where you're talking about these are the things that are or not putting you at risk. And maybe your breast cancer, that's not something that is putting you really at risk. But again, that's a patient specific sort of discussion.
Mm-hmm. Mm-hmm. It's, you know, when you say that, it makes you kind of think as an individual more holistically. What can I be doing to kind of boost my own immune system? What can I be doing to take care of myself in terms of the level of risk that's acceptable to me because of me, not necessarily because of some big statistic. And so when early on, when we saw the commercials from, you know, the CDC and the WHO listing all the categories where you had higher risk and like cancers in there, like you said, but we've got to qualify what cancers, what treatments, what comorbidities make you part of that higher risk group. And so I think, you know, information is power, and early on we didn't have a lot of information. And I'm not saying we're much later on, but we have done a really good job in gathering the data to be able to make more informed decisions. So I appreciate too that you come at that question on fear and anxiety from a place of, let's take a look at the data. Let's really look at, where you fall in to the sets of people that are at higher risk. And then you can do with that what you need to in order to get that mental balance. Sharla, hopefully your audio is good. Let's just do a quick test.
Yeah, can you hear me now?
Yes, we can hear you beautifully. Okay, so same question, Sharla. Philly having that big city population and closeness, how did you and how are you providing cancer care that feels at least normal for patients, and what do you have to say to patients to encourage them that pursuing care at this time outweighs, staying home and thinking that you're being careful?
Yeah, Sarah, I want to say more than ever, it's become our utmost responsibility to provide safety to our breast cancer patients and really to ensure the quality of care. Although it's being reported in the media and out there that COVID-19 infection tends to have a bad outcome in people who have cancer or people who may have underlying comorbid conditions, but we really have seen a very high variable course with this infection, ranging from self-limiting condition to maybe a serious disease. So we really need to spread the message that it doesn't apply to every single person with cancer, that they are going to have a bad outcome. But nevertheless, I think the kind of care and attention our breast cancer patients needed truly has not changed at our practice, as well as in Philadelphia and most places. I think anything we did was all about risk calculation. Prioritizing patients with breast cancer on therapy who were high priority that needed treatment with a definitive intent, continue to go on to get their treatment following all the safe mitigation procedures, or people that were low priorities, such as, if they were on surveillance and needed to postpone some of them, restaging images were done, but now everything is trying to get back in place. Few of the clinical trials were also placed on hold, thereby interrupting our patients from getting tomorrow's treatment today. But thankfully, guidance was issued by FDA in modifying to address this COVID-19 related issues using virtual visits and so on. So I think addressing with much more care, concern, assuring our patients that it's a lot safer to be in the hospital, especially when a safe place has been created at each of the sites with all of the measures that's being followed, whether it's using PPE, whether it's wearing masks, whether it's being screened multiple times when they are in the center, whether the staff is being reminded and constantly self-monitored for symptom and wear necessary protective equipment. I think those measures really have played a huge role to continue on with the care for breast cancer patients. I think patients should feel assured that their care is never going to be stopped or delayed because of COVID-19. But yes, there's going to be some measures taken in between.
Yeah, and on a previous town hall for breast cancer, we had Hal Burstein from Dana-Farber, and I always remember the way he kind of defined how they at Dana-Farber and probably at all of your institutions addressed breast cancer care. So he was saying, if you've got a patient diagnosed with breast cancer and they've got to go through, let's say, chemo, radiation, and surgery, and our standards of care were that you had to do it in that order. Think of it more like having a 3-course meal where it's appetizer, main course, and dessert. It doesn't necessarily matter if you have dessert first and appetizer last, you're still getting the holistic treatment. And so using the data that everyone could come up with to make these fast, on the move decisions, the oncology community really rallied so that you'd be able to still provide the holistic care, but in a safe way, so that no one walked away with something lacking. And I think for me, that always resonated with me because it's something that I could say over and over to friends who were fearful that COVID was going to interrupt quality of care. No, it just interrupted the order of care in some circumstances, but the intent of the care was still always primarily on the oncologist's mind. So I also feel always that that gives me such peace of mind too, that I'm able to kind of share with others. Jane, we started this town hall interviewing advocacy leaders. I know that you're a person who is very active in advocacy both on the patient level, but also in the provider level, making sure that, you know, women are well represented, making sure that mentorship programs are strong, utilizing social media in ways that really connect the audience with, you know, the provider. How has the need for partnerships with advocacy organizations been enhanced during this time? And what is your resonating message to colleagues about making sure that they stay connected to those advocacy organizations that really are there to advocate for the patient?
Sure. You know, I think at this point it's a moving target. I think one of the hardest things for patients, and as you were talking about sort of anxiety, I was thinking about this on multiple levels for our patients, because I think with COVID, what I've seen is that anxiety and depression actually have gone hand in hand. Like the patients who were never depressed before are coming in and they are kind of admitting those symptoms, and we're talking about it. And some of it is that this whole social distancing thing has also led to a lot of social isolation, particularly for patients who live alone or who are so fearful of interacting with the world that they sort of lose some of those connections. And I think sometimes when you're overly anxious or depressed, it can get hard to, you know, kind of, people start to ask, like, what is the point? What's the point of going through all this? You know, and it's different for metastatic patients than it is for patients in the curative setting. But I think mental health in cancer patients is something that is so important and has become something that's more prevalent, having mental health issues now because of this pandemic. You know, I often refer to situational depression. You know, even if you weren't depressed before, you know, this is something that we may need to help you deal with. And I always tell patients, you know, social distancing doesn't have to mean social isolation, and, you know, set up that Zoom call with your friends, go on that like socially distanced walk with your neighbor, or wear a mask. You know, the people who make you feel the best about yourself, make sure you stay connected to them virtually or otherwise. Because I think the risk that we place people out of being in poor mental health situations, especially with cancer, is big right now. And I think that is enhanced sometimes when, you know, things don't go according to plan with their cancer care. So, you know, like they can't get their drug on time, for example, or, you know, they can't get their surgery scheduled, or they're not able to afford transportation, you know, like different things like that. And I think, you know, the financial piece is another piece of it. But in terms of what advocacy organizations can do, I think one of the things I've found most helpful is for patients who, for example, find themselves in more financially unstable situations now because of job loss or transportation loss, all these issues that then compound the challenges of cancer care, being able to connect with advocacy organizations, even to like help with money for drugs or money for fertility preservation, you know, before chemotherapy. These things that used to be less hard are all harder now. And so being able to kind of make connections as directly as possible is one of the things that I think is best. And I guess the mental health piece, I'm not trying to necessarily have any ideas per se about how advocacy organizations can help with that, but I think one of the main things we can do as providers as we try to enhance our relationships with advocacy organizations is to be able to really highlight kind of from the trenches of the clinic, so to speak, you know, what are the biggest issues? Because I think, you know, oftentimes like friends or my kids' friends' parents will ask me, you know, just kind of in casual conversation, what are some of the hardest things about, you know, COVID and your practice? Like, how are you still going to work? What is this like, et cetera? And I think for me, one of the things that has required the most time and energy, and that I'm not sure I have the best answer to, is how do we keep lifting people up and keep supporting people mentally and emotionally going through this when so much is falling down around them, you know? And so being able to kind of bring those aspects to the forefront, I think is something that's very helpful. I don't know if that totally answers your questions, but
no, I think it does. And even, you know, to fill in from a patient perspective, to fill in a gap for you, when I went through 5 years of, I mean, for anybody that knows me, chronic debilitating pain. I mean, and every doctor that I saw was like, you're fine. Like, they couldn't find anything on imaging. Regular blood was like, she's fine. So everyone's like, I don't know. And it's 5 years of that where you're feeling it every single day until finally, and I credit so much to Kevin, who was like, you need to see a rheumatologist. And I ended up seeing a rheumatologist who changed my life because she said, I have an answer for you. There's this, I found something. And it's like, nope, you think patients don't want you to say I found something, and in cancer, you definitely don't want to say you found something. But for patients with autoimmune diseases, it's like finding something means validation. But as you were talking and you were saying, what could advocacy organizations provide from the mental health perspective? When I left my first visit with the rheumatologist after my diagnosis, she said, there's a couple of Facebook groups, here's some names of them, connect with them. And I remember coming home and, asking to be allowed into the Facebook group and then getting allowed in. And I'll remember this the rest of my life. I sat on my couch for almost 6 hours and almost the whole time was crying because the stories of the people on the page, I went back years, and the stories of the people on the page were my stories. And it was like, for the first time in my life, somebody heard me. And I think for advocacy organizations where they're able to provide platforms of communication, where I can connect with someone who looks like me, sounds like me, has life situations that are similar to mine, the unlocking of validation and of empowerment and of that shared emotional experience is unparalleled to anything I've ever felt in my life. So I do believe that advocacy organizations provide that, and that can be priceless at a time like this where someone says, oh my gosh, she's saying everything I'm feeling. So I do encourage, the physicians listening and nurses listening to connect with advocacy, even if it's just for that. As we kind of round out, I have a question for Kevin and a question for Sharmila. Kevin, as Jane was talking, she was, as all of you do, you put the patient first. It's what you do. It's the trait of an oncologist. You put your patient first. What are you doing for you? What do you think healthcare providers right now should be asking themselves on a daily basis, checking in for mental health, for support services systems, making sure that the anxiety we're feeling about our kids, our partners, etc. What do you say to your peers about mental health during COVID-19?
Yeah, it's a really good question. And I think that there's a lot of balance. And we've already kind of talked about some of this, balance of family and everything going on. I think that one of the things that I worry about for me and my colleagues is that since March, we're all pretty much staying where we are. We're all really available. We're not traveling, going out about. So the expectation of really being available is higher in a way that I would say was not necessarily the same before COVID. And I think that taking some time and having, even if it's just of a day of a break where you're not, interacting on email or reading papers or writing a paper, something like that, so that you can, everybody keeps their sanity by, certain things, whether that's exercising or reading a book or spending time with your family. Everybody has the ways that they can keep balanced. And part of my concern is just, and this is something that I talk about with some of my colleagues, is just to make sure that we are remaining balanced so that when we are interacting with patients, that we are really able to fully give, right? Because if the tank is empty or the tank is half full, it's really not quite the same. And that's, we don't want that to be impacting anything for the patients, right? And any decisions. And we still want to offer good care. You need to offer good care for yourself so that you're able to offer good care for others as well.
Yeah, yeah. It's very important, I think, that we don't fail to ask that question, because you are already in a field where you have to have a full tank. Every day you have to have a full tank. And I'm not saying anything negative about a dermatologist or another medical specialty, but there's something so intimate and vulnerable about oncology that's really unlike any other field. And so I told Sharmila on something, if you look behind me here, there's a list of you guys, everyone who I work with on my own speaker bureau. And as many times as I have to like take my moment, I flip my chair around and I pray for each of you by name. I go down that list and because I know what it's taking from you right now. So I think it's so important to constantly check in with each other and check in with the people that love you the most, to say, you know, I'm not feeling okay right now. Like, I'm feeling kind of overwhelmed or whatever. So I appreciate that those conversations are already happening, Kevin, because it's so important. I mean, you have to be healthy to help other people get healthy. Sharmila, along the same lines, especially as you have, you know, you're a provider with kids that are facing going back to school decisions, things like that. How are you managing that work-life balance, mental health situation with both being a provider and then being a mom and a wife?
Yeah, Sarah, it is certainly, first off, bringing that awareness by itself, I think is going to be a great help. Just talking about it, acknowledging what is happening right now. We know that there's constant threat to our identities. We know we're so uncertain during this time. How long is this going to last for? We lost our freedom. Some of us may have even lost some relatives or friends or family members. We don't know, is life going to be normal? I have a daughter who's going to start her senior year in high school. This is going to be her last year. She's still uncertain about this hybrid model, going to school. What if a case happens in the first week? The entire school system is going to be shut down and going to go virtual. So I think on one level, it has certainly deepened our empathy, especially when we pause and we just think of what's happening. But I think recognizing is the first step, first off. Talking with one another, I think, certainly helps. And then there's so many creative ways that most of us have come about during this shutdown time, during this COVID time, staying amidst ourselves, socially distancing. I think sharing that information really helps. If somebody has said, oh, they spend their time gardening, or they spend their time connecting on Zoom, or did something creative, so that gives an idea for others to consider that. For me personally, I think it has helped, along with my entire family, to connect with a lot of other friends through Zoom on many occasions. So we never felt that we were socially missing out. Although, you know, there is obviously hugging one another, the personal touch, that definitely is lost. But I think the first level is to acknowledge and then to share ideas and being there for one another. In terms of work and with our colleagues, yes, especially with the nursing staff and the rest of the team, I think it's really important to address whatever the anxiety, the distress. Many of them have even reported lack of sleep. You know, our place has made available a lot of resources. There are people checking on at multiple levels at various, and our physicians, a group of us even have a forum where we meet up every few weeks to share our experiences. In this way, it has helped us grow professionally as well as personally too, to overcome not only the current situation, but our professional woes that we get to talk about and share our experiences. So I think ensuring that there's a safe place, not only for our patients, but for us personally, for our colleagues, for our staff. I think highlighting all the positives, and, you know, if there's faith-based, relying on that to get the emotions. And then I think another important thing also, which although we have telehealth to see our patients and continue their care, what we are lacking is that sometimes we fail to pick up the subtle nonverbal cues that you get, like facial expressions or postures or emotions. The same way, I think we should also fail to, we may fail to recognize that amongst our colleagues, amongst our friends, amongst our staff. So I mean, I would say that a basic tool of empathy that we as a physician have, we should put it on a pedestal level right now to recognize all of that and be there for one another.
Yeah, absolutely. Well, I as much as I ever can do for any of you, all it is a text to me, and know that you're always in my heart. And at my hardest times, I turn my focus on to thinking about each of you and what you have to go through all the time. And so I want to say thank you for this segment with the three of you. It's been incredible. I know that the listening audience has gotten a lot out of it, because I've gotten a lot out of it. As I ask Raina to transition us to our clinical nurse educator, again, I want to thank the three of you, and then ask you to kind of sit tight until we all get back together for Q&A to round out the program. Eric, great to have you on. You're on mute, so perfect. Great to have you on. I am excited about this segment because it's the first time that we have had a clinical nurse educator. I'm the daughter of a nurse. I have been around nurses all my life, and the perspective that nurses bring to every situation, clinical and beyond, is a perspective that really has another human being in mind. You're calling to serve other people, just as a nurse to start with. So I'm really looking forward to how this segment goes and what we're going to learn from you. So to start, can you introduce yourself and tell us a little bit about your organization and what you do there?
Sure. So thank you very much, Sarah, for having me. And I'm just really thrilled to be a part of this today. I think this is such a great thing to do for patients.
Yes.
And for nurses as well, if we have nurses on the phone. I am a clinical nurse educator for Puma. And I cover the Mid-Atlantic, so I go from Philadelphia down to North Carolina. I've been an oncology nurse for over 20 years. I started out in a large community hospital on a 40-bed medical oncology and bone marrow transplant unit. I then went to infusion. I was an infusion clinic nurse for a while. And then I did patient education / navigation in the days before there was the term nurse navigator. At Puma, as a clinical nurse educator, my role is to educate nurses, physicians, pharmacists, advanced practice providers on new drugs, on the appropriate use of those drugs, on side effects, how to manage side effects, really trying to make sure that all patients have access to the medicine and the resources they need to make the best use of the medicine. That's kind of what I do.
Thank you, Eric. You know, you mentioned a lot of things I want to kind of get to in our short time together. The first being this notion of navigation, which I'll ask you to describe, and maybe you can weave in how nurse navigation actually enhances access not only to things that we think clinically, but just access to education and someone that you can think of as a partner throughout the journey of your cancer treatment.
Yeah, so navigation really has become a very important role, especially in breast cancer. And actually that's how navigation started, was through breast cancer. It started in Harlem with, I'm blanking on his last name, but he was at the Ralph Lauren Cancer Center in Harlem, and he noticed that women, especially women of color, were having a difficult time navigating the system, right? Navigating the healthcare system and getting from their care, their diagnosis, their treatment in a timely fashion. And that's really where navigation began. And today, and it's especially true, I think breast cancer is really the best illustration of this. There are so many different physicians that a breast cancer patient has to see and interact with, different tests, lots of things that require timing. And so having a navigator who essentially is responsible for making sure that patient gets through the system, keeps moving through the system in a timely fashion, right? So from the time they have that suspicious mammogram till they get their treatment, and even through treatment, there's somebody following that patient and making sure that they're getting to where they need to be.
Yeah,
so really a critical role.
It's essential, and I can't even imagine that there was a time where we weren't helping navigate patients.
Right.
So absolutely. So Eric, I want to talk a little bit, when COVID-19 kind of first changed everybody's world, pharmaceutical and diagnostic companies globally in oncology and beyond started to wonder how they would conduct business in this new world where access was a challenge. Can you talk to us a little bit about how Puma responded to COVID-19 and how you provided that continuity of access to all the stakeholders involved in your product resource?
In this situation, this whole time of COVID, I think being a small company it has a lot of advantages, right? And that's because we're small, we can move quickly. Once we identify a gap, we can try to fix that gap, right? And I think that's what we've done at Puma very well. For instance, we had pre-COVID, right? We have a voucher program which helps patients get the supportive care medicines that they need to be on therapy. And that voucher program before COVID was only available to commercially insured patients. And then COVID hit and many people became uninsured very quickly, right? And Puma was able to expand that program very quickly so that patients could get those vouchers that they need and stay on therapy, maintain their therapy well, right? So I think that's one area that I think we did that really, really well. We're also, I think, doing a good job of listening to our customers and respecting their decisions of limiting face-to-face interactions, but also still providing them with the education they need. So we've done a lot of we set up virtual appointments very quickly and I think very effectively. We created a telehealth tip sheet for customers so that they could, especially in the smaller communities where maybe they weren't as savvy technically, this was something that could help them implement telehealth. From a patient advocacy standpoint, we're doing, we multiple platforms now. So using Twitter and Facebook Live and for events like this, right? We've been able to do that. We also have an outstanding mentor program, and I know I heard people talking about this earlier, but we do have a mentor program where patients can actually be paired up with someone, a peer who has been through the complete treatment and can speak to a newly diagnosed patient or a patient that's been newly put on Neuralinks. So that's really effective. And then we have a call-in center, a nurse call-in center. So if patient has an after hours kind of question, they can jump on that and get answers to their questions. And then I also would say that as a CNE team, we've always had this goal at Puma to be the people that empower our patients and providers so that people can have the best experience. And that's really the view that we take, is that we want to empower people to be able to get have the most benefit or be able to be on therapy for as long as possible, get the best benefit with the least amount of side effects.
Yeah, you mentioned Puma being able to kind of transition quickly because it's a small company. I think I would take it a step further and say it's because you always started with a strong mission, and the mission was to empower the patient. So whether Puma was this large, multi-billion-dollar organization with global offices, or the size that it is, you never lost sight that that was your goal. And I think probably from a leadership perspective, every kind of tactical or strategic discussion was about how do we continue to empower the patient so that they have the right treatment for their disease at the right time. We had a couple of other town halls on breast cancer, and one of the organizations featured was Pfizer, and it kind of fits that massive organization with bunches of not just oncology, but they're in other spaces. And I felt very much the same, that when you talk to the people involved, like you, like your team, that the company or the corporate mission was always in mind. How do we continue to reach not the customer being the doctor, but the customer being the patient that's in need of our clinical intervention? And I really do believe, when I kind of take a step back and look at the landscape of who's doing well, the companies that never lost sight of the patient are the ones that's doing well. So I appreciate that about Puma and about your leadership, because I think that's why you've remained as impactful as you have. In our final few minutes, again, as I started talking to you about what I feel like, and of course I'm biased because I have the best nurse in the world as my mom. If you had a message, if you could give a message to the cancer community from your perspective, both from your clinical and your personal perspective, in this moment, what is that message?
Well, I love this question. So thank you for asking this. I think this is great. So much of the cancer experience is out of your control, right? Yeah. You're told what doctors to see, what appointments to make, what medicines you're going to take, when to take them. There's just very little in your control, and I think that makes people feel dependent, and it raises your anxiety when you have no control, right? And so I would say that one of the best things you can do is to try and focus yourself and educate yourself on the things that you can control. So that would be things like maintaining the rest of your health, right? The cancer part is out of your control, but you can maintain the rest of your health. Supporting your immune system, making sure that you're getting the best possible sleep. And if you're not, then focusing on, healthy sleep habits, nutrition, doing the best that you can do for yourself around nutrition, exercise, even if that's walking, there's no judgment. Walk a little bit. If you're really fatigued, the best thing you can do is get up, walk down a few steps, walk back up a few steps. That gives people a sense of relief from that overwhelming fatigue when they have that. And breast cancer patients have a lot and can have a lot of fatigue. I think, COVID is going to be over at some point.
Yes.
And when it is, I think we want to be able, and I think this goes for all of us, emerge from this as our best self, right? In the beginning, we were joking a lot about I'm going to come out of this really heavy. I'm going to be really overweight because I don't care. This is COVID eating and all of that. But I think it's, if we can focus on little things, like maintaining sleep, like improving your health, that will help us emerge from this even better than we were before. And that's my hope and my goal.
Yes, I love that. Thank you, Eric. That's a message that all of us can take. Like you said, it's not just for the cancer community in terms of patients only. It's really just for the human community.
Right.
You know, do things in your control and do things that make you feel joyful and that make you feel better, you know?
Yeah.
So there's enough already. At the outset of the interview, Tracy said her goal is to make things easy at a time where everything is hard. And I wrote that down because I think that that's so amazing. And I love too, I wrote yours down, emerge as your best self. Like, what a great takeaway for this time. Well, Eric, thank you so much for being with us. Stay tuned. We have the Q&A at the end. I'm going to ask my team to bring Sharla up so that we can talk about the patient experience through this time. Hello, my dear Sharla. How are you?
Hi, today I'm doing really well. Thank you, Sarah, for having me.
Very good. Well, you know, as I mentioned a little bit earlier in the town hall, everything for me changed at the end of last year, where I got to add patient to the number of labels that I have in my life. And I think that that's what makes these segments with patients so not just personal, but powerful to me. Because previously, as I mentioned, you know, the focus was always on the provider, and it was in the absence of the patient voice. And I just feel having the presence of this powerful voice changes everything. Because when we talk about, you know, the tolerance to side effects, well, who are we to talk about the tolerance to side effects if we don't have someone who's experienced side effects saying, well, actually, let me share with you my experience so that we can do better. So I appreciate you being here because you give us a perspective that's not just nice, but necessary. So I'd like to ask you to take a couple of minutes to just introduce yourself and share with us your journey with cancer and where you are in the moment along that journey.
Okay. For the purposes of this town hall, my name is Sharla Manglitz. I am a second-time breast cancer patient. So I have the insight of going through treatment pre-COVID and during COVID for cancer treatment, which I think for the purposes of this is an insightful bonus.
Yes.
I have broken it down into pros and cons, but just to give you a little bit of my history, I received my first breast cancer diagnosis in the fall of 2014. I had the big three. I had surgery, chemo, radiation, and it really wrecked my body. So from a patient's perspective to give feedback, that was a really hard recovery, and I didn't really fully recover, and then was diagnosed with a recurrence in the fall of 2019. Again, I mentioned that there are pros and cons to the treatment during COVID. And the pros, in my opinion, outweigh the cons. And I'd like to start with the cons, continue with the pros, and then end with a suggestion that I think is relevant both pre and during or post COVID, if I may.
Yes.
Okay. So for the cons to begin, this time in my personal experience, I had, I think if I'm counting correctly, 7 surgeries since December related to my current diagnosis. The majority of those surgeries took place during the peak of the COVID madness, March, April, May. One of my surgeons contracted COVID, and that he was off the grid for a couple of weeks, which was a negative effect for me and his other patients for my personal care. The physical therapy offices were shut down because there was an obvious fear and justified fear of transmission of disease and how to handle physical therapy. I was not able to receive lymphatic drain massage, which was critical post-surgery. for a bilateral mastectomy that I had done, as well as the physical therapy that I did mention. So those aspects were necessary and lacking and frustrating for the patient, but logically and practical, they're understood why they happened. I had the bilateral mastectomy, I had infections and complications, and over the course of those surgeries, 7 drain tubes that had to be inserted and then surgically removed. And that created a real severe emotional and mental roller coaster for me. And I felt like the mental and emotional portion of care was under duress in my first case, but particularly in the second case, which occurred, as I mentioned, during the initial lockdown of COVID. And I felt like the cancer system that I have gone through was obviously very fragmented and focused on trying to do what was necessary, and they did do what was necessary. But the emotional and mental health, I think, really fell by the wayside. Nurse navigators became overwhelmed in trying to navigate a new landscape during COVID. I was also unable to travel to Texas for a second opinion and or treatment, even though I was an established patient. My oncologist had a second subspecialty in infectious disease, and she was pulled into the COVID task force. So that was another adverse effect. But I'd like to move on to the pros of treatment during COVID and experiencing this. And to begin with, we've talked a lot. I've heard a lot of your speakers speak about televisits, and they have been incredibly helpful. I feel that we get more quality time. It's one-on-one. It eliminates a lot of the office distractions. It eliminates a long commute for me and for the physicians, my providers. It eliminates childcare issues for myself and others. And it also eliminates a lot of the clinical delays with just overflowing parking lots, overflowing lobbies, overflowing clinical rooms. And it's very streamlined, and I really appreciate it. I find that as another pro, I have better access and quicker access to my healthcare providers and their support staff. Their response times are tremendously faster, as are referrals to other subspecialties and imaging and surgery scheduling that I've had to personally receive, as well as receiving treatments in CTU. It's just so streamlined, and I think that there's a focus on sanitary measures that I think will stay with us, and I think that's a good thing. I think that the current landscape of a lot of the televisit and the online community and things that can be handled remotely will hopefully stay with us. I recognize that for some people, not being able to bring someone with them into the cancer clinic for whatever purpose, be it a visit or for treatment or for surgery, might be a hindrance. But in my personal experience, I found that auditorily and visually, there was so much less stimulation. It was quiet, it is peaceful, and the wait times are just so vastly reduced, and you're in and you're out, and it's not this stress-miss type thing. So that's been a pro. I think that having that blanket rule of only having the patient coming into the clinic or to the office probably won't stay with us, but it has been a benefit during this time. In addition to that, the elimination of the extra cell phones, the chatter, the non-patients, it's just a lot of, the mess is gone, the zoo is gone. It's kind of weird walking through hallways. It feels like zombie land. But again, as a patient, I really appreciate the time and that they've expedited things, and they do pre-screen at the door for COVID symptoms and all of those things. So I feel like it's safer than it has been. I have not been worried about, personally, I have not been worried about contracting COVID as a patient in the clinic. That's not to say at the hospital, but at my clinics and things, in my doctor's offices, I feel like it's very sanitary and people take really good measures for distancing and hygiene and everything else. I did reach a breaking point emotionally and mentally, going back to that issue, at the end of June, after one of my chemotherapy treatments that had outrageous side effects for me, and I became overwhelmed. And I was able to go to a holistic health retreat in South Florida for a few weeks where there was no television, no newspaper, no talk about COVID. Everyone was tested before they came on campus. So it was a world of no masks, and it felt familiar again. And it was really rejuvenating. And to have to leave that and come back into a polluted environment and honking horns and smelling exhaust and hearing about COVID on the TV again and the obsession of the numbers was a real drastic change. But having that break was really, really important. I'm grateful I had the opportunity to do that. In conclusion, in my portion, for my part, my suggestion as a takeaway for healthcare facilities and practitioners, I felt that both times of my diagnosis and my journey, and I am in the medical oncology portion of my journey this time. I failed with chemo. It was too hard on my system, so we had to abort that. And I am currently taking Herceptin and a hormone blocker. But I felt like there was a lack of mentorship. And what I mean by that is being paired with a former cancer patient that has been through this, and that they're able to offer their insight, and someone that you can discuss topics with that are really important but largely overlooked and underserved in the healthcare system. And that can be anything from, what is it like to have a bilateral mastectomy? What kind of equipment should I be looking for? What kind of bras? Do you have a recommendation of wig companies? What about intimacy? What about sex? What about personal relationships? What about dating? And all of these things are not addressed or have not been addressed in both of my cancer experiences. So it would be my suggestion, if possible, to implement something, if not that, something similar to that.
I think that, first of all, I want to thank you for sharing your story.
Sure.
I really do believe that sharing stories about our experiences, it's like you're pouring yourself into someone, maybe for now, or maybe for later, or maybe for someone else. So I really always thank patients for sharing stories about their experience. I love that you came at this from, you know, I need to be real about the things that sucked, but I want to also be real about the things that I appreciated throughout this. And as you were talking, one of the things that I was feeling along with you was that contrast between when you went away on the retreat and kind of had to come in back to reality. And I almost want to marry that with what Eric was saying about so much of the experience, so much of our human experience right now is dealing with things out of our control.
Yeah.
So as much as we can control those things, like turning off the electronics, like creating a little sanctuary or retreat within your home that allows you to have this safe space or safe time, it's like building new controllables can be really powerful. You know, it's not the same as that artificial environment of a retreat center, but it can give you back the sense of control you had before all of this and really change the way emotionally you deal with the things that are happening. So I loved the way you came at this. I loved your takeaway lessons for us. I loved your positivity. And I definitely, along with everybody else on the town hall, wish you nothing but the best from here on out, and let's stay connected so that we can continue to share the story. I'm going to ask Raina to bring everybody else up for the last 20-ish minutes, and I am going to share some of the questions from the social media platforms that we're on, as well as some of the questions from the open Q&As. So thank you everyone for being back on. And I'm going to go through some of these Q&As. So right away, how do we share information, or how can we share information about the resources that are available? In addition to what's on the chat, this will all be available on the Total Health page, Total Health Conferencing page, so that wherever you are and whatever you need to access, you can. There's questions about volunteer opportunities for the advocacy organizations. You know, visit both Gilda's Club and FloridaBreastCancer.org to find out ways that you can get involved. I can't tell you the power of advocacy in this moment. I probably don't need to tell you the power of advocacy. And don't think of being an advocate as this huge, unachievable commitment that you're going to be making. It could be that every day for 5 minutes, you pick up the phone and become part of a phone chain, checking in on people that are living right now with social isolation. It could be helping rally a few people together to write letters to policymakers so that, you know, drugs can become available. It might be posting on your Facebook opportunities that advocacy organizations that are near and dear to you have available so that others who might have a little bit more time can get involved with. So I always caution people in staying away from feeling like, well, what can I do? You know, I don't have a lot of time, or maybe I'm not skilled in these certain ways. Trust me, we always can find ways to use you because like we've mentioned time and time again, we can't do it alone. Okay, so I'm gonna go to another question. Do you find patients are saying they are worried about getting their treatments? And Kim, you had answered yes, appointments have been rescheduled, delayed, and treatments postponed through COVID. Jane, I'm actually gonna ask you to answer this live. You know, the patient advocate community is saying that they're hearing patients saying they're worried about getting treatment. What do you say to that patient? Is it as simple as pick up the phone and call Emory, or call your local center and make the first step?
You know, I tend to take a more hands-on approach to that as the patient's doctor, because I think for each patient, whether or not to get treatment or to do whatever it is you need to be doing or should be doing in a non-COVID situation for your cancer care, now is sort of just a new discussion of risks and benefits. Because I think anytime you are going to give someone chemotherapy, for example, it's a discussion of risks and benefits. You know, there are certain risks, but then there's certain things that, you know, a reason why we're giving it is because we want to cure your cancer, or in the metastatic setting, we want to prolong your life and improve your quality of life as much as possible. And I think, you know, for every patient, that sort of like the risk of contracting COVID and having a bad outcome with COVID is different. And so is the potential benefit from treatment. You know, I find actually in my practice, the patients have been actually pretty much along the same lines as what I would recommend for them. You know, most of my young patients and even many of my older patients who are on active treatment for their cancer perceive that coming into the cancer center, as I was talking about before, is actually not that risky of a thing, globally speaking, as much as other things are, because there's all this screening and all this sanitization and everyone's 6 feet apart, and they need their treatment for their cancer, or else it could recur, or if it's already metastatic, you know, it could progress faster. So most people here have not had an issue with coming in for their scheduled and recommended treatments. I would say where there's been a little bit of give and take has been, you know, for example, I have like older women on aromatase inhibitors I've been following for 4 years who, you know, sort of, maybe now they've moved to South Carolina, for example, and they see how bad COVID is in Georgia. And they're like, do I really need to come for my screening mammogram in September, or can I come in December when my husband's also coming for this visit? And I say, absolutely, you know, come in December, because that's fine. So I think, you know, it's really, I would encourage patients who are worried to talk with their clinicians openly about what their worries are, because sometimes, you know, it may be that if they're worried about contracting COVID, they may feel better if they hear about what the institution is doing to protect them from COVID, because most institutions are doing a lot to make sure their patients stay safe. And then I think they also benefit from hearing their doctor's assessment, you know, of what their risk versus benefit analysis is. You know, how much do they need this planned treatment versus what might their risk be from COVID if they were to come in and get it.
Mm-hmm. So thank you for that. And I think the major takeaway that we're hearing from Dr. Meisel, which I know would be echoed with Dr. Kalinsky and Dr. Aithal, is communicate it. If you're a patient and you're saying, I'm worried about this, in addition to saying it on the support group, saying it to the advocacy leaders, say it to the people who can make a difference in that worry. Say it directly to your doctor. Doc, I'm worried that, and fill in the blank, because as we've heard from the three of these physicians on with us today, not only are they there to answer that question, but they're expecting that question and they have the answer for you. So don't be afraid, or don't think that, you know, you're in some way insulting them if you share the fears that you have from, you know, kind of how to manage through treatment during COVID-19. So thank you, Doc, for sharing that. Okay, I have a few Facebook questions. I have a few Facebook comments and questions, I will say. So we have people saying, I love Gilda's club. And I echo that too, Kim. From very early in my career, I encountered Gilda's Club, a small support group, and I've been touched ever since by the way you reach people. So I echo that commenter. I love Gilda's Club. Tracy, we have someone saying, how do we support mass? So this person is asking, even if they can't, or they don't have a recommendation for a pastor or a church, is there a way for them financially or otherwise to support mass?
I think the best way right now is just to help us get the word out. So something as simple as going onto our website, seeing the information about Mass and the upcoming events and sharing them. It could be as simple as sharing onto your social media pages. It could be printing it up and taking it to your church, telling your friends. I'm trying to think if I think that's probably the best way right now.
Sure, and then just
probably. Yeah, I was just going to say, if you have any other questions, just call us.
Yeah, that's what I was going to say. Just stay connected to Florida Breast Cancer Foundation, both on their website, or maybe just send an email to contact us and say, hey, if there are other opportunities for me to engage, let me know, because I know that Advocacy is always looking for partnerships. I have a person who said, Sharla is a warrior. She makes me so proud. And I have a question. How does she stay so positive?
Well, what a compliment and what a question to try to answer. I have had my peaks and valleys for sure. I have had a breaking point, and that is when I went away to the retreat in South Florida I spoke about, because I felt that my mental health was in jeopardy at this point. I'd been dealing with cancer for 6.5 years or so, and it's been exhausting, frustrating. But I have a 10-year-old son, and I have to keep him at the forefront of my focus, and have gratitude for everyone that has helped me physically or emotionally throughout the process, not once, but twice. So I'm not always positive and bubbly, but I felt like I was reset after I took some time off and got away from all of the COVID chatter and the television, and really was able to disconnect where I went and really was able to recover. And I received a lot of therapy there physically. I had lymphatic drainage and a lot of treatments there, as well as psychology treatments, and talking about times like these and what I was going through and what I had lost. And you lose a sense of femininity, at least I did, and your sexuality, and dealing with all of that was really overwhelming. But getting the right help is hard to find, and I was grateful to get some. So that's what helps.
Thank you. Well, I think all of us echo this listener in that you really are a warrior, and you do make us so proud of the way you're tackling all of the things that you're facing. And I know, being a mom myself, sometimes it's like you fake it till you make it in terms of those little ones. They have an expectation of you, and you're like, they're the reason I'm here. So you live up to the expectation. So thank you too for sharing that.
May I have just one more statement?
Absolutely.
I think that when you're at your lowest of low, you're totally entitled to your feelings. And I think it's important to honor both the negative, positive, and your real status and how you feel. And what I found helps me is when I come back full center is I try to give back to something or to someone. And I try to help, and I try to reach out so that, I don't know, I just feel like that cycle is beneficial for me to remain positive and helpful when I'm able to do that.
Oh, that is beautiful. And the key takeaway for that is not just to give to others, but that you're entitled to your feelings. Mm-hmm. Because so many times I think we tell ourselves like, oh, but we don't have it as bad as something else or someone else. But then what we're doing is dishonoring that we're feeling a certain way in that moment. And so I love too that you started with that. We're entitled to our feelings. Okay, someone said that they loved Eric's answer, and they put in caps, control my controllables. So Eric, thank you for empowering and gifting us with that. And I'm going to end with our kind of funny thing because we can't, we're a couple minutes over. I take the blame because of my tech issues. But I don't want to let anybody leave without a smile on their face. There's a woman who's changed the world and continues to change the world, Lily Shockney, who has developed these programs for patients with metastatic breast cancer, among other things. And she says, laughter and joyfulness activate T cells, which are our most powerful defense against everything. In fact, she tells us all that every day find something or someone that makes you have a great big belly laugh. So I'm going to go around the room and ask everybody, in the spirit of this being a back to school season, I'd like each one of us to share something, whether it's hilarious or whether it is run of the mill. Fill in the blanks about you as a high school senior, most likely to. Eric, since you're at the top of my screen, so Eric Cohen, most likely to fill in the blank.
Wow, I've changed a lot since high school. Most likely to be on Broadway.
Oh, very good, Eric. That gives us almost like we want to know more, but we don't have time. So thank you for that teaser. Okay, Dr. Kevin Kalinsky, most likely to.
Oh, I feel like I need way more time to answer this. What initially came to mind, and this is embarrassing, I can't believe I'm saying this, but I guess what would be most likely to also be okay coming home from school in eating Little Debbie's and watching Facts of Life.
I love it. Who was your favorite Facts of Life character?
Oh, that's a good question. I feel like Charlotte Rae. I feel like
of
she
course.
in check. But you have to love 2D also.
Yeah. Okay. Very good. Oh my gosh, I'll totally make a date with you where we eat Little Debbie's and watch reruns of Facts of Life. Tracy, most likely to.
Well, I've had a few seconds, so okay. I would say most likely to have a helmet head because it was the 80s and my hair was just perfect. But when I look at those pictures,
right.
That's and then I'm going to follow Eric and add to it and say, and be found at the same time watching Little House on the Prairie. It's a little secret about mine. And to this day, my husband will know if I am going through something, and if I'm in a down mood, if something's bothering me. If he sees me binge watching Little House on the Prairie, there is trouble.
I got it. Okay, we're really getting deep. This is like a therapy session too. Okay, Kim, most likely to. Oh, you're on mute. Most likely to be on mute in your future during a global pandemic.
Most likely to skate in the roller derby.
Oh,
what?
Awesome.
That is amazing. Okay, I feel like I got to do a reprise with this group. Dr. Jane Meisel, most likely to.
It's so hard to answer this question, but I guess what I would say is multitasking has always been a forte of mine, and I multitask differently now than I did in high school. But I would say most likely to sneak out to a party one night and then show up early for physics class the next day.
Very good. So organized chaos.
Organized chaos.
Got it.
Yeah, it's been a theme for 20 plus years.
Very good. Noted. Okay, Dr. Sharla Aithal, most likely to.
I think in this new COVID season, I probably would love to do a virtual prank, probably with the teacher, or maybe bring a friend to virtual school who doesn't belong to that school and have some fun.
You were the class prank. You were the class clown. That's what we're
love to play a prank.
Okay.
Yeah. It's virtual. Come on, it's virtual. So
that's right. That's right. Zoom bomb something. Okay, yeah. And then Sharla, most likely to.
stop for speeding and be able to talk my way out of a ticket for
Oh,
sure.
good one.
Wonderful. Wonderful. Well, thank you to everyone for joining us for this virtual town hall on breast cancer. We really do these things so that we can connect with you. We feel the absence of connection just as much as the rest of you listening and participating. And hopefully what you've found from this is that all of us are doing it. All of us are going day by day. All of us have our own struggles, our challenges, our opportunities, our silver linings. And that all of us are really working our best to marry our passion and our purpose with reaching out to you right where you are. So we hope you've enjoyed this time with us. Like I said, all the resources to reach any one of us will be available for you. And I appreciate you spending precious time with us over your weekend. And I encourage you to share this with others who you think might need that same belly laugh. So thank you to all of the panelists. Have a wonderful rest of your weekend. And I look forward to a time where we could really be together.
Thank you, Sarah.
Have a great
Thank
Thank
you
you for
so
having
much.
us.
Bye, everyone.
Thank you. It's a privilege. Thank you.